Welcome everyone, and thank you for attending another Expats Portugal webinar. Tonight we're going to be discussing healthcare in Portugal and explain the different options available to you. Our very special guest is Nuno from Winsurance, who is a wealth of information when it comes to this area. Bit of housekeeping: if you've got questions for the webinar, please put that into the chat. We will be finishing the recording in about half an hour, and then you'll be able to put your hand up and ask more personalised questions of Nuno then as well. But for now, that's all. So over to you, Carl.
Thanks, Astrid. Thank you very much indeed. And yes, as soon as I complain about the weather here in Portugal before the webinar starts, people rightly putting me in my place. Minus 18 in Canada from the Canucks who are with us tonight. Good evening to you, Canucks, Rebecca, Connecticut, Patrick and Barbara. Funny you should say that. -5 in Maidenhead in the UK. Good evening to Robert over there. Good evening to you, Linda and Derek, enjoying slightly warmer weather, I think, in the Algarve. Anna in Cascais, good evening to you. Ray and Vera, I think, glad to be in Alcobaça rather than somewhere colder from where you previously came, I believe. Tom Smith in Ohio, -3. So we're all good to go, basically, here in Portugal. Aren't we lucky, Nuno, to be here in warmer weather? Thank you for being here with us tonight. Nuno Menich from Winsurance. And you have team members with you. Might be nice, Nuno, if you could introduce us to the team members who are here this evening, because it's very likely that people who call and speak to you at Winsurance will be speaking to some of these people that are here with you on the call this evening. So should we start there? Good evening to you.
Hey, thank you so much for having me today. Yes, we don't have here always the same people. So today we have here Sandra Costa.
Hello, everybody.
Hi, Sandra.
Hi, Sandra. And Cristina.
Hello.
Good evening, Cristina. Good to have you here with us.
So feel free to do questions on the chat, because they could reply to you.
Definitely. Okay. Sandra and Cristina. And I know Ruta as well, also here, will be working behind the scenes as well. So, Nuno, a slightly different approach tonight. We love talking to you about the healthcare system in Portugal, the private, the public, how they overlap, the kind of hacks and what we should be aware of from your point of view, not only as a man in insurance, but obviously as a Portuguese citizen who's grown up with this system as well. Slightly different approach tonight, I think. Do you want to tell us about that?
Okay, so as you know, our field is insurance, but insurance is based on data. And I love management, and to manage, to do wise and correct and accurate decisions, we must be informed, and we must have accurate data. So the basic of today's presentation is data about healthcare, about health issues, and the health structure that Portugal have to support everyone that is residency in Portugal. Okay, so once you are moving to Portugal, or if you are already here, or if you are thinking what you will face regarding healthcare structure. Okay.
Yeah, that's wonderful. Thank you.
So, data. This is a word, a phrase that we heard a lot of times. I'm healthy. I'm pretty healthy. I do exercise. I eat well. I do this and that. And some months later, a problem arrives. And this is true. We have had situations that after 6 months, something have to put a pacemaker. For example, we have 2 cases from the expat community last year. 100% healthy people, one of them vegan. So that's why in insurance we say that health is only a transitory state. Okay, so let's see why. About metrics. And talking with metrics, what were the sources that we used? The national plan to 2021 to 2030 is based on data of 2019, 2021. Okay, Also about the INE. INE is the National Institute that do statistics to everything. Okay, also about health, about hospitals, and so on. The Fundação, it's a private organization without profit objectives. And also, I have checked what is happening in US regarding causes of death in US. To do a quick comparison, I realized that we cannot compare directly Portuguese statistics of death with the US, because here we have much lower level of crime, so people are not dying due to that. Also, the food, the nutrition is different. Once you start arriving in Portugal, we start hearing you talking about olive oil and the vegetables, fresh vegetables and fresh fruits. So there are things that are different. So we are going to focus based on the Portuguese statistics, okay? Nevertheless, the main disease that people are dying for are pretty much the same. So cancer, circulatory system disease, digestive systems, but it's important to see these according the age, because yeah, I've been pretty healthy during all of my life, but statistics say to me these, that between 50 and 65, 70 years, so between 50 and 70 years old, the main disease of death is cancer. So this is a reality point, okay? And the second one is cardiovascular disease and heart disease. Basically, these two correspond to 2/3 of the reasons of death in Portugal on that specific ages. But the good news is that there are cancers and disease that we are dying for that are 100% treatable. And these are the main disease that are treatable and the ones that we are dying for in Portugal. So colon cancer, cardio disease, cardiovascular disease, breast cancer, and pneumonias. This is a more detailed information. I'm not going deep. I'm not thinking on going deep to this. It's additional information. If you want to go deep, please let me know and we can talk about this. So in the end, it's about what my intention here today is what we could do, how we can manage, how we can plan ahead to have a longer, healthy life. So life expectancy in Portugal by the age of 65 is almost 20 years long. And from those 20 years long, so 19.9, 17, almost 8, we are living on a we have a healthy life, but not so healthy afterwards, the 8 years. So the last 11 years of life are not so healthy. Other interesting statistic is that women live longer, but men have a longer healthy life, okay? More 1.5 years almost. So what we can do with that information, what Portugal have to offer to prolong, to extend the healthy life. We are talking about facilities, or we are going to talk about facilities, about professionals, assistance, kind of assistance, and what is the role of the Portuguese state, of all of us, the community, on extend the healthy life. So in Portugal, we have 240 hospitals more than 50% are private hospitals. And we have specialized hospitals to treat oncology, okay? And we have them on the public system, we call the IPO, and on the private system. I should say that pretty much all of the private hospitals have a specialized department to oncology. We have a particular organization or hospital called Fundação Champalimau. They are a research center, an international research center based in Lisbon, dedicated to study and research oncology disease and to treat oncology disease. Besides this, we have healthcare centers, clinics, dentist clinics, 3,400 labs, 3,200 pharmacies, and besides pharmacies, chemic pharmacies, we have natural pharmacies that we can find on any region, any location in Portugal. Okay. So about the professionals that we have. Oh, and sorry, regarding hospitals, we realize that each year we have more hospitals, but mainly we are getting more hospital beds available. Available, yeah. So this information is about the professionals. We have almost 59,000 doctors. 62% of them are specialists. We have more than 80,000 nurses. We have more than 16 pharmacists and more than 11 dentists. I have highlighted the name of these organizations, Ordem dos Médicos, Ordem dos Enfermeiros, and so on, because every professional to be legal in Portugal must be registered on one of these organizations. Okay. Healthcare assistance. In 2000, it is related to 2021. So in 2021, we had 1.1 million hospital admissions. Is like if 1.1 million could be not be much thinking on the US reality, for example, but here we are 10 million. So it corresponds like 11% of us to have admitted at the hospital in 2021. Okay. We had 130 million lab works. We did 130 million lab works. And we did 60 million exams. Thinking once again that we are 10 million is like that everyone did 6 exams during 2026. Okay. About the how Portugal care of their residents. So 11% of the GDP is dedicated to healthcare costs, and 2/3 of the total health expense is supported by the state. A particular view about medicines and vaccines. So in Portugal, because this is a question that you do often to us, which is, and what about medication? How much we can get from the insurance? Are they expensive? So in Portugal, we have a contribution system based on categories. So due to the medicine's effectiveness, the disease, the severity of the disease, and the personal situation, and this could be because I'm a pensionist, because I have a disability of certain percentage, because I earn less than 14 minimum wages a year, I could have a higher percentage of contribution. So the Portuguese state has defined 4 categories. Medicines categorized as Group A, the participation of the state is 10%. So our copay is 10%, okay? Medicines categorized as B, the participation of the state is 69%, as C, 37%, and D, 15%. But what was the reality in Portugal in 2021, once again, is that 20% of the medicines had a contribution of 90% from the Portuguese state. 39% had a contribution of 69%, 40% of 37%, and a minor percentage had 15% contribution. What this mean, and you can see the evolution during the last years until 2022, is that in the reality is the national healthcare system, the Portuguese healthcare system, has supported 66%, 2/3 of the overall cost of all the medicines sold in Portugal. Okay, here we are considered only medicines that requires a prescription, because other medicines like I think a paracetamol, they don't require. There are medicines that don't require prescription, and we can buy them on the supermarket, for example. So these are not. I think that they are not accountable on these numbers, I think. Okay. So regarding vaccination, Portugal has a national plan according age and group of risk. Most of these, the majority of the vaccinations are free, so we don't do any copay. Regarding and focus to people over 50, tetanus and diphtheria is available during the whole life. I think that we need to renew every 10 years. Flu is provided over 50, and COVID-19 over 68. Flu and COVID, I believe, I'm not sure, I believe that in this moment they are free. And I say I believe because I know someone that by the end of the 2022 took the flu vaccine, and she need to pay, but in this moment it's free. Okay, where we can take vaccines on the public healthcare centers, the centros de saúde, and at pharmacies. Pharmacies provide flu and COVID vaccine. Tetanus and diphtheria, I believe that is only on the public healthcare center. When I say I believe, remember that our field is insurance, okay? Oh, and by the way, this information we got it through the link of the SNS, okay? It's a governmental website. Now, things to be aware. We could think that these are only mistakes, unawareness, or could be something else. But starting for why private, who is who, not Jews, and same coverages. Let's see what are these topics. Why private? So population aging. So we are getting older, and the pressure on the public system is becoming higher and higher. The demand is rising, and there are a lack of capacity of the public system. They are slow to respond to this demand. So this will take time to realize that they do the adjustment, the necessary adjustment to the actual reality. Also, there are some financial pressure on the public system. This is something that we are facing on every side of the national budget. There are innovative treatments, innovative procedures like the use of robotic, innovative medicines. Private provides a quickness on appointments, exams, treatments, and surgeries, and provide more hospital beds rather than the public system. So this is about availability in the end. Who is who? Trust and be reliable is very important on everything, but on the healthcare side, to be more important even. Just for curiosity, these are news from Portuguese TV channel, which is SIC, S-I-C, SIC. And in December, January, we had three news about doctors that are not doctors, or doctors that did the procedures that they are not allowed to do. So my suggestion is that every time that you attend to a doctor that is not part of one of the healthcare networks, check the doctor, okay? This is public information, so I'm not providing nothing special. So this is the Ordem dos Médicos, is the organization that requires that every doctor should be registered here. You just need to access, put the name of the doctor, and they will show you every doctor's the official number of registration, the specialty, if they are working or not, and so on. Also about brokers. So ASF is the organization that regulates the market, is the regulator of the insurance market, regulates insurers and brokers. So insurance appears here. I did the search, so it seems that we are allowed to be on the insurance brokerage business, but not through affirmations that we are hearing once in a while from our some of our customers. One is that public is enough. Yeah, you could rely on public, but just be aware of the news. It's on every day. We know that they are struggling with lack of capacity, okay? So the public probably is not enough. In my opinion, is not enough. For all of us that have health insurance is always plan A, even if I need to pay 20 euros for the appointment, okay? It's better rather than wait 4 or 6 months for the appointment and wait 8 hours on the line for the appointment. One thing that we heard last week is that oncology treatment, it's only on public. This is absolutely false, okay? I've talked about Fundação Champalimau, and if you search on CUF, Lusíadas, Luz, all of them have do oncology treatments. They have specialized departments to deal with oncology treatment, oncology disease. Also, that we heard that it's better to keep the health insurance together with some organizations. There are hospitals that have their own is not plans, is discount plans, is not an insurance plan. So they present this that is better to keep all together. Also, there are companies that provides assistance or advice, as you can want to talk, that they also are on the insurance business, not because they know about insurance, but because they are on the healthcare or the health assistance side. There are one big issue regarding sharing information. The data protection law, in Portuguese RGPD, denies that hospitals, clinics, doctors share information between them. So usually what happens is that we attend to the closest private hospital and we start being following them. Usually the first assistance is with the general practitioner. And if we need some specialized appointment, they recommend someone from the same hospital. And we stay from that point forward, we start being following on the same hospital, and the hospital have all the information. But that hospital cannot share information with other organizations, okay? Also, we heard a lot of times that, yes, pre-existing conditions are covered. And we work with all of the main providers of health insurance, and we know pretty well their wordings, and this is not true. So if someone say this to you, require them to, they write to you an email or something saying this. So if tomorrow, if you have a problem, and you have a problem, you could be somehow defended with that document if the company yet exists, okay? So, but that's my recommendation. These are not true. Also, we struggle with this because it's not true that, oh yeah, the coverages are the same. So you remember the Lord of the Rings, okay? So a ring that rules them all. So here we have the wording, and the wording is what rules the insurance policy, point. Not what Nuno say, what insurance say, what Allianz, MGN, no matter who says, is the wording, okay? So, and it's pretty easy. Requires, with the quote, require, my recommendation is that you require the wording on PDF, and you can search for exclusions. And you realize what are the exclusions. And I assure you here, 100%, that with the exception of one insurer, all of them have disease excluded. All of them, okay? Also, be aware that sometimes we can see the same coverage and they are not covering the same because they have a different wording, a different description. Also, it's also important to understand that the healthcare network and the insurer, they are completely different organizations, okay? So healthcare networks work with different insurers. For example, Medis work with Liberty, with Zurich, with AGH, and Millennium, BCP. Advanced Care worked with MGN, with Victoria, with Generali, Tranquilidade, and so on and so on. So the healthcare is the provider who provides the access to the doctors, and the insurer is the one who says what they will pay for, okay, and what will be your copay. Same insurance policy could have different insurance systems. And here is the role of the broker, mainly. I'm not saying that you do not rely on the banks, but banks, they are focused on numbers, and only a few of their workers know something about insurance and are allowed to provide a full assistance regarding your insurance policy. And this is very easy. You just need to sit in front of them or by phone or online and start doing questions. It's pretty easy to evaluate this. Also, the reputation of the broker. Okay, so different brokers have different reputation and different influence on the insurers. And when I say different influence, I'm not saying to do nothing bad, only because some brokers, when they say something, insurers know that is true in point and go forward with that. What could be our role on all of these? So what are our commitments? We are deeply committed with our why, which is protecting people and goods. Point. Basically, it's about this. On the left of the screen, remember that our commitment here is to use the tools that we have available, so insurance policies, to provide better assistance and extend the healthy years here in Portugal. You can see, because sometimes people start talking about other insurers, that they are very good and this and that, and this is not us. This information from someone here under the picture. You have the link who did the research, and they consider that these 8 providers are the one who make health insurance work. So health insurance with an H, absolutely not. So sorry for the mistake, for the error. So health insurance work. And we are talking about Multicare, which is Fidelidade, Medis, Advanced Care, MGN, and the other 4. Most of you know that our solutions, the solutions that we in insurance, some of them we have tailored, others we just adopt and use to reinforce the offered value regarding healthcare. We are using from these, we are using Multicare, Advanced Care, MGN, and RNA. We work with others, okay, like Allianz and Medis, but these 4, RNA, MGN, Advanced Care, and Multicare, are the ones that we are focusing more. Oh, and by the way, we are focusing based on the proposal value of their products. Because, by the way, just to know that MGN is the insurer, our earnings came basically from the insurer. And MGN is the one who paid less from all of them, but he's the one who gives us the better response towards healthcare and health insurance. What we do for you, not what we can do, but what we really do for you. Our commitment is being fair with you. I know that someone is here on the audience, and this week they have called me asking about an insurance, and I just say to them, my opinion is that you don't need, because this and this and this is your choice, your decision, but my opinion is that you don't need. So if you don't need, because you already have or whatever, we are fair, we're fair with you. we choose empower customers rather than hide information just to show something. We always tell you how to use the insurance policy, no matter if it's health, life, car, or whatever. Okay. Also, you know that we are always behind you. So if you are struggling with something, you are just one call away to assist you. The information that we provide, we try to compact it, to try to be easy to read, but it's also comprehensive. And we don't have fees to make claims. Also, we have, this is from our website. We have some useful information to you available. Cost of living in Portugal, mainland hospitals, waiting time. This is something that is, so all of this is available. We can do some show off with you, but this information is available and we don't need to wait to talk with us to access the information, okay? Also, you have official apps that support your healthcare in Portugal. And I'm talking not on the private, all the hospitals have their app, but there are public apps that helps you to scheduling appointments, to search the waiting times of the hospitals, and so on and so on. So all of these, we keep it available to you. It's on our website. We often say that our business, and I don't like the word business, but it is what it is. But our business is not insurance. Our business is trust, and because we want to be here for many years ahead. We have 50 years of experience accumulated. We rely on the personal interaction. So yes, we are a high digital company using AI and so on, but the personal interaction, it's key on the relation and the understanding what are the needs of each of you. Also, we provide our personal mobile phone numbers. In my case, I don't have a private and the professional. I have only one. Our quotes are in English to most of the insurances. We are English-speaking team, and we fully comply with the data protection. Also, and regarding trust, only very reliable brokers can tailor insurance products. So the insurer need to rely on the broker to do this, and we have this, and we have this to the expats community also. Well, it is what it is. It means what it means. So we are proud to have a 4.9 score on Trustpilot. And on MJN, we are the only one that can say this. We are the first broker. So MJN has started on our office in Lisbon. We have made with them together the first wording of the MJN's products. So we have a long and a deep relation with MJN. Also, underlying trust, on our webpage, we also, this information is not yet there, but will be, that are reliable, not partners, they are more friends, like EI, Resiplicano, Daniel Reis, Spartan FX, and so on. Okay.
Great. Thank you, Nuno. And that's is, of course, the happy ending that Rebecca was asking for, with some of the statistics that were there earlier in the presentation. Rebecca was saying, "You're bumming me out, Nuno. I hope there's a happy ending." Well, there is. There you go. The high ranking and all that, the lovely testimonials that have been coming in while you've been talking as well, Nuno, talking about the team. And how approachable you are, backing up all the things that you said in the presentation there. So thank you very much for that. The big questions were, what do you do health insurance? We'll be talking about health insurance tonight, of course, George, we are, and life insurance. A question came in about that. So let me address a few of those this evening, the questions that have come up while you've been presenting. Thank you very much for that. Thank you for setting the scene in such a comprehensive way, and then delivering your solution to this particular situation where we find ourselves with healthcare in Portugal at the moment. Thanks for being here, says Rebecca earlier on, and Elena at Insurance Rocks, from Patrick and Barbara as well. Some speculation about the leading causes of death that you touched upon there in the presentation. We won't go into that right now. Let's get to people's questions of you this evening. Jose Cruz speaking very highly of you, and of course your details. You haven't got a private number, you've got a public one, a very public one, so people can get in touch with you this evening, and it's right on the screen there, should anybody need that. I think, George, your question has been answered. Will we discuss health insurance? That's what insurance are all about. If you've got any further, more specific questions, ask those now, and we will we'll carry on with this recording for a little while, and then we'll have a more private session after this recording is finished, so that people can ask more personal questions as well. But get those general questions in. Jose Cruz, helpful with your information. I just got my most recent COVID booster and my flu shot at no cost, says Jose, at my local Saúde clinic in Ardos Cunhados. It was easy, you're saying there. Thank you very much. Tom Smith asking, Nuno, I hear a lot about doctor shortages. Is there any truth to this? Is it a regional thing or a sector thing, i.e. public or private? Shortage of doctors then?
Sorry, about doctor, what?
Is there a shortage of doctors in the country? Actually, the volume of medical.
I should say that on the public, yes, definitely. That's why we have so long waiting time to get an appointment.
Yeah.
The statistics say that we have a high number of doctors, lacking of doctors, and the statistics says that more than 1 million residents in Portugal don't have a doctor on the public healthcare system, and I'm one of them.
Okay. Yes. All
So
right.
yes, but this is not happening on the private. So if you need an appointment, I'm pretty sure that you can, and you try to schedule it today, you can get it to tomorrow. I'm pretty sure.
Think that will be many people's experience here, if anyone cares to comment on that. So thanks for that, Nuno. Thank you for that question, Tom. Jose Cruz, with a lot of great personal information here. Not too personal. We had interface with both private and public facilities here, and there are 4 doctors who reside on our streets, as you say. There is a severe shortage of staff, addressing that previous question there, especially doctors in the public health system. There also appears to be significant underinvestment in their infrastructure, as our experience with the public hospital in Torres Vedras confirmed. What our doctors have told us is our national health system is excellent if you have cancer or in a car accident or have a heart attack. Otherwise, it is virtually impossible to be seen urgently or to get an appointment in a reasonable amount of time. For example, a friend waited almost 1 year to be seen for an earache in the public system. This, says Jose, is the key reason to secure private health insurance, backing up what you've said there, Nuno. And with diseases excluded, pre-existing conditions. I think we've addressed that, Ed and Sharon, from earlier on. So if we haven't, do come back to us on that. Thank you very much. Andrea was asking you to enlarge some of the graphics on your presentation. Now, this presentation will be available to see again, and hopefully you'll be nearer your desktop when it's published on Sunday at 6 o'clock, Andrea. And when you asked, it was a bit late in the presentation, but if there's anything that's not clear to you still, do ask, and we'll address it for you directly with Nuno now. Is the Portuguese private healthcare network moving towards more disease prevention approaches in addition to disease treatment? That's a great question, Gail. So do you think there's a shift towards functional medicine and preventative medicine, Nuno, in the private system?
I don't say that is a shift, but that the demand is becoming higher. Okay,
Yeah.
so some insurers already provide access to what here we say well-being networks.
Yeah.
And well-being, they work more on the prevention side, like nutrition, for example, thalassotherapies, and so on.
Mhm.
Also, know that in Portugal, we consider some non-Occidental practices also has medic, like acupuncture, for example.
Okay.
So yeah, we're not luckily we don't rely only on the Occidental medical.
Okay, so some alternative and complementary therapies in the mix,
Yes.
some of
Yeah.
which can be obtained through insurance. And Dwight was talking earlier on in the chat about an osteopath. There's a pretty good provision of alternative and complementary health practitioners throughout Portugal, and you can interface with some of them using private health insurance. So great question there, Gail. I'll extend on that. I mean, some insurance companies, Nuno, are giving people I think this is elsewhere in the world. I don't know how prevalent it is in Portugal, but if people take an active role in their health and have regular checkups and pass certain metrics and criteria with their health, they can qualify for discounts or preferential rates. Is that a trend here in Portugal as well?
There is one insurer that has an app that is checking everything that you do. Okay, how many steps you do every day, and so on.
Yes.
Yeah, and they give you some discount due to what the app has has reported to the insurer.
Yeah.
Nevertheless, when we are talking about healthcare, the discount is a secondary. It's important,
Yeah.
but it's a secondary point.
Okay. All right.
Important is how comprehensive is the coverage. Otherwise, you can have a very affordable plan, and then when you need,
Nothing
you need to pay it by your pocket. So
some people might want to know what that insurance policy is so they can avoid it being monitored all the time. Anyway, Patrick and Barbara are asking, does the patient file claims with the insurance company, or does the doctor's office electronically send claims to the insurance company? So how does it work with claims?
with claims. So for example, we brokers, we are limited in our actions on helping you because we cannot access to your information. The insurer, they don't tell us what is what claims you did.
Mm-hmm.
We don't know. We can have some number, but not what was the reason, the disease or whatever. So this is this is one part of the claims. The other part is how the system work regarding medicines and appointments and surgeries and so on.
I think that's what Patrick and Barbara are referring to. Yeah.
So the regarding medicines, we need a prescription point. Okay.
Yeah.
To most of the medicines, not to every, but to most of the medicines. And it's not important if the doctor is from the private or the public. We only need the prescription. With the prescription, we attend to the pharmacy, and they know by the medicines, by the QR codes of each of the medicines, of the prescription, they know automatically what is the copay that we need to do.
Okay.
So they have the systems connected with the state, and
so it's up to the healthcare providers to make that connection with the insurance company.
yes.
And I know of a situation where it's worth getting a second opinion, given that we're talking about health, but when it comes to some personnel in hospitals saying, oh, we don't work with that system. It's worth double checking that, isn't it, in some instances? Because I know of one case where an expat foreigner was told that their policy didn't work in a certain place. They were quite distressed to find that out, and it was a mistake on the counter within the healthcare provider, wasn't it? And actually, their insurance policy was valid.
Yeah, this happens more times than is supposed to happen.
Much, right? Yeah.
Because we know that the red phone that Russia and the United States have, supposedly, that also the healthcare providers and the insurers or the healthcare networks, they have the the red numbers or
Right.
or red phones. Okay.
Okay.
So if the system is not working, they need to pick up the phone and call to the healthcare network to check.
And it's okay to ask them to do that.
And they never do this.
Yeah.
Because this way, this is an excuse, and this way they receive all of the money up front. Point.
Of course. Yeah. All right. So it's worth being pushy on that should you find yourself in that situation.
Yes.
Okay, great. Colleen, thank you. I have all my insurance with Insurance. Great people, great company who I greatly appreciate. A lovely testimonial there. Thank you, Colleen. Derek, similarly, Nuno has been wonderful in handling our health insurance, as is his team. Complete trust. There is a nice little quote from Derek as well. Rebecca saying, honest brokers are worth their weight in gold. Of course they are. And all your details are in there through the business directory as well. Let's take a few more questions if we can, and then we'll go to a more private setting in a few minutes' time. Excellent presentation, Nuno, says Arab. Very informative. One query. For pre-existing disease, is there any waiting period under MGen policy? Yes. Or it's covered from the date policy. So our waiting periods, can you talk about that?
Yeah, okay. So waiting periods, they vary among insurers. Once again, insurer is the one who defines the wording, okay? So waiting period differs among the insurers. Regarding MGN that you have asked about, the MGN has two waiting periods. 90 days to most of the situations, doctor appointments, treatments, exams, blood tests, and most of the minor surgeries. Minor surgeries are usually the ones that don't require the overnight stay at the hospital. Okay. And this is the main waiting period or grace period. The second is 1 year, and 1 year is to pre-existing conditions, congenital disease, some severe disease, but all of them are very well identified on the wording of MGN. Okay.
All right.
Nevertheless, there are no waiting period from a certain point of view, which is due to an accident or a sudden illness that requires hospitalization, right away hospitalization. There is no waiting period. Also, there is no waiting period if we attend on the healthcare network. So since day one, we can start using the insurance policy. What happened is that within the waiting periods, we will be paying more rather than after the waiting period. So we will not pay the public hospital rate. So not all the public hospital rate. We will not pay the copay after the waiting period, but we will pay something in the middle, like 50 euros for a doctor appointment.
Okay, thank you for that, Arab. I hope that answers your question. If a person has a pre-existing condition, ask Ed and Sharon, like rheumatoid arthritis, does that mean you cannot get insured? No, right? And your team have been busy working behind the scenes. Perhaps with some of these, you might want to ask your more personal questions after the recording has stopped, because I think you've been answered by the insurance team there, including from Rebecca. If someone has a pre-existing condition but only needs monitoring and nothing else, i.e. no treatment, would MGen cover required monitoring even in the first year? So let's address that a little bit later on in our lock-in, as it were. Andrea, as I understand, MGN does not pay for medical care after the service has been rendered. Can the patient then know exactly the amount they will be reimbursed before they receive the service, and how long does it take to be reimbursed?
Okay, so to be reimbursed, and we send always detailed information about how to use the health insurance and what to do in case of a claim, how to do in case of attend to out of the healthcare network doctor. You need to register it yourself on the advanced care website or app.
Okay.
By there, you can access to all the expenses that you did. What are your usage limit? Because limits in Portugal, we have annual limits per insurance policy, per insured person. So all of this information is available on the portal.
So you'll be able to see that in the back office, basically, the answer to Andrew's question there. Good. Okay. For those of you who do like the complementaries and the alternative therapies, Dwight's saying osteopath that Dwight uses doesn't go through insurance, but privately, €30 a session. So thank you for that. We might talk more about that a little bit later on. Gail Robbins, 4.9, trust score is amazing. Well done with insurance. And Denise says, I'm sure this is the result of continuous hard work, and it starts at the top, Nunu. Well done. You can be very proud of yourselves at Winsurance. Important question here. From Linda, thank you, Linda. Can insurance companies drop clients for age and or illnesses? Basically claims they might have made, I guess.
With the exception of MGN, all of them.
Okay.
All of them can drop clients, and all of them can apprise the insurance policy individually based on claims.
Right.
Okay. So two persons with 50 years old, if one start doing claims, the insurance premium of them will be different.
Yeah.
MGN is the only one that don't do that.
Right. And the $64 million question that we'll close on tonight, and that isn't an answer to the question, $64 million, because that would be expensive. Could you give us an estimate of private health insurance annual cost for a male of 60 years of age? Is it too difficult to give a general quotation of that kind? Or can you give us some sort of idea, Nuno?
Oh, I don't have the rates on my mind, so sorry.
Okay, fair enough.
Too many numbers.
However, Jeffrey, it's a good question, and others here, I think, if we pause the recording there, I'm sure others will be able to step forward with examples of some of the subscriptions and rates that they've maybe even secured through Winsurance this evening. So we've been on for about an hour with the recording. So let's pause it there, and we'll go to any questions we haven't managed to get to during this session, and any further questions or things that you would rather not share publicly. For those of you who are with us tonight, and of course, if you want to be on the call, sign up at expatsportugal.com to be on the call and to join us for this second part that we're going to go into now. But for the time being, Nuno, thank you very much. And of course, your team working very hard behind the scenes as well. So thank you, mate. And let me just stop the recording right there.